Hi everyone, I'm Chantal Yashova,
Hello, everyone. I'm Sean Nishragi.
and we are continuing our presentation on averting future vaccine injustice. Adequate public control over knowledge is essential for rapid open sharing, given companies' strong commercial interest in withholding knowledge from competitors.
With legally binding commitments for upfront public funding for vaccine R&D, IP monopolies would not be necessary to induce innovation. Governments could make their funds go further by pooling them through regional or global vehicles such as the CEPI, which is mandated to secure global access to the vaccines that result from its investments.
Early in the pandemic, governments acting unilaterally largely invested in companies based in their own countries. Though unsurprising, this approach generates smaller, riskier portfolios for each country and ensures neither equitable access nor adequate global supply.
In contrast, the CEPI developed a geographically diverse portfolio of vaccine candidates that spread out both scientific and manufacturing risk. Some companies that received large-scale grants from the CEPI include AstraZeneca and Novavax, which made stronger commitments to allocate supply to developing countries, price their vaccines affordably, and transfer technology than did some other companies, which include Moderna and Pfizer.
With funding from 17 governments, the European Union, foundations, and firms, CEPI was among the world's 3 largest public research and development investors, having committed over $1.4 billion, more than 90% of it public funds, primarily for R&D, but also for manufacturing, alongside the United States' $2.3 billion and Germany's $1.5 billion.
More in-depth evaluation of CEPI is needed to elucidate the factors that facilitated and impeded global access in this pandemic and to provide lessons for the future. Nevertheless, it offers proof of principle that governments can invest together in vaccine R&D upfront, at risk, at scale, and for access.
In a context of geopolitical competition, however, not all governments may be willing to cooperate so closely on the sensitive security issue of pandemic vaccines. The United States, Europe, Russia, and China all rapidly developed COVID-19 vaccines that have now been deployed globally.
A network of regional funds could complement a global entity like the CEPI by investing in vaccine developers closer to home, while agreeing to coordinate and adopt common binding roles for transparency, pricing, and sharing of data and technology. Successful vaccine development anywhere could then mean vaccines produced and accessible everywhere.
Beyond funding, binding international rules are critical for ensuring rapid sharing of pathogen samples and related data. The sharing of genomic sequencing data on SARS-CoV-2 by scientists in China on the publicly accessible GISAID platform in January 2020 jump-started the development of diagnostics and vaccines worldwide.
Rapid international sharing of genomic sequencing data has also been essential for tracking emerging variants, but such data sharing rests on soft norms of scientific cooperation and is not reliable. International sharing of physical pathogen samples is also critical, but lag behind the flow of sequencing data.
An international agreement could mandate rapid, open sharing of both samples and data contingent on guaranteed access to the resulting benefits. For example, research results, scientific credit, training opportunities, and countermeasures for the originating researchers and countries.
The 2011 Pandemic Influenza Preparedness Framework, developed by member countries of the World Health Organization, established such a quid pro quo. All countries agreed to share influenza samples with a WHO laboratory network in exchange for assured access to at least some vaccines and other technologies that companies would subsequently develop.
The political bargain that this framework struck provides a foundation on which to build stronger rules covering all pathogens and data. After vaccines are developed, there is likely to be at least an initial scarcity of global supply.
Ideally, all governments would commit to consume only their fair share and to permit exports of vaccines produced in their jurisdictions, but such promises are not politically credible.
A more reliable strategy is to build scientific and industrial capacity to develop and produce adequate volumes of countermeasures in all regions and to negotiate rules ensuring that knowledge and technology are globally shared, even when physical products are not.
Using and expanding regional manufacturing hubs today are necessary steps toward ending the current pandemic and preparing for the next one. In 2013, governments rejected the chance to advance a WHO treaty establishing an international public fund for medicines research and development and rules making the resulting technology openly accessible.
We should not lose the opportunity now to craft international laws that would make future pandemic vaccines available to all as global public goods and avert a repeat of the ethical, epidemiologic, and economic catastrophe that is unfolding today. Thank you all for your attention.
Thank you, everyone.
Goodbye.